Good morning, it's Karen from CCASA. It's been a while since we've done a public policy update, so we just wanted to quickly give some folks some information. It's only Wednesday, but it feels like it's been longer because we had hearings on Monday and Tuesday that were pretty busy. So on Monday, we had a hearing around K through 12 schools and what sort of information schools and law enforcement DA's offices collect regarding school-based discipline code violations, school-based crimes, that sort of thing. So Colorado schools are required to annually submit safe school reports that includes data on prevalence of all different types of activities that can happen in school that can range from discipline code violations all the way to criminal activities. It's a pretty robust list, but something that's missing from that list is sexual violence. Schools are not required to track reported incidences of sexual violence that happens in their schools. So we are trying to change that, and we're trying to sort of couple it with Title IX and get a number and a sense of how many Title IX investigations are happening for sexual violence in K through 12 schools. So it's a complicated piece of legislation. That bill was laid over for further action, which means it's not dead, but it means there's more work to be done on it. So that's an issue that we're working really closely on, and if it's an issue that you've been affected by or would like to learn more about, definitely contact me. Yesterday we had a couple hearings. One was House Bill 1220, and that was really around increasing college campuses' partnerships with sex assault nurse examiner programs and sex assault victim advocates. That bill passed out of committee 8-2, so we were excited about that and glad to see it's moving forward. And then we testified against Senate Bill 77, which we thought could really cause some harm for minors that are seeking care or services. And the bill would have made it necessary for them to get parental consent, and we know that can be really hard for some kids, especially if the parent isn't safe. So we opposed Senate Bill 77, and I'm glad to say that it was killed yesterday, so that bill is no longer a problem. CCASA's priority bill, Senate Bill 128, which creates an anonymous reporting option and makes some clarifications around the medical mandated reporting statute, just to make sure that we have a more victim-centered approach to victims who are getting health care following this crime. I'm very happy to say that bill has passed. It's passed both the House and the Senate, actually passed unanimously, so now we're just waiting for that bill to be signed by the governor. So it's almost spring, but we still have a little ways to go with our public policy work. The session doesn't end until beginning of May, so if you would like to be involved, there's plenty to do. And feel free to send me an email at advocacy@ccasa.org for more information. Thanks again.